Runners, today we take a deep dive into one of the most common and seemingly dreaded running injuries, shin splints, or what we professionals call medial tibial stress syndrome. Throughout this masterclass, I'm going to be helping you to understand what shin splints are, who gets them, and most importantly, for the bulk of the video, we're going to go over how you can help yourself to recover from them. Super important. As this is our first injury management masterclass, I thought there'd be no better place to start than discussing shin splints, as it is estimated that up to 35% of runners suffer with shin splints at some time in their running journey. Shin splints is a non-specific term used to describe pain in the anteromedial part of the leg, or the front of the leg, which is aggravated by loading or impact activities such as running. There are a variety of tissues in this area that can be implicated, including the bones of the area, like the tibia, also the muscles and the tendons of the muscles, so tibialis anterior, tibialis posterior. Those are the typical muscles or bones, etc., that can be implicated in shin splints. Pain can vary in intensity. It can often get worse after long runs or speed work, hill sessions, or whilst running on uneven terrain. Sometimes pain can be bad enough to cause a runner to limp or alter their gait or stop completely. At other times, you can feel pain whilst running and it's kind of manageable, but later on that day or the following day, it can cause significant pain and cause you to limp or alter your gait the following day. Shin splints is common in many impact sports like running. It's a particular feature in running, like I said earlier. It's estimated up to 35% of runners will suffer with shin splints at some point in their running journey. And those at most risk of getting shin splints are people that are new to the sport, those runners that have a slightly higher BMI, people that have a previous history of shin splints, those that have used orthotics or are using orthotics at the moment, or people that have recently increased training loads for whatever reason, for a race or something like that, or those that are generally quite deconditioned and are returning to running. Just put up on the screen some factors that you may want to consider that may put you at increased risk of developing shin splints. So how do we treat shin splints? Well, in this section, I'm going to be going over all of the things that I would advise in clinic with my patients, all the things that you could be doing at home to help you have the best chance of recovering from your episode of shin splints. The first thing I'm going to cover is rest. Now, for the longest time, rest was considered a good treatment option for a lot of conditions. Now, science has moved forward, musculoskeletal healthcare has moved forward, injury management's moved forward, and rest is not commonly prescribed as a way to treat conditions like shin splints anymore. There's lots of other things you can be doing that give you more power and control over your direction moving forward, and we're going to cover them in this section. Nutrition is an area that we have so much control over, but also we lack so much control in, unfortunately. But adequate nutrition becomes super important when we're injured. We must focus on giving our bodies what they need to recover, and that comes in the form of food, of course, and hydration and sleep. But we'll cover nutrition for one moment. When recovering from the injury, I try to prevent my patients, or I don't recommend patients are in a calorie deficit whilst they're recovering from an injury. The reason being is because when they're in the calorie deficit, they're limiting the amount of calories they intake and limiting the amount of nutrition that's available to their tissues for recovery. Although we know that calorie deficits and then the subsequent weight loss that comes with them can improve performance, specifically in endurance sports as our power to body weight ratio improves, in terms of recovering from an injury, what I would always advise is that we match calories to maintain body weight and the performance that comes with that, and get the adequate calories, nutrition in for recovery. Your body will always need to basically cover the basics. So we need to cover, protein, carbs and fats and our micronutrition, vitamins and minerals, and we need to ensure that all of this is accounted for within our nutritional strategy. Now, as I said earlier, there is a consideration with shin splints specifically, and with knee pain and other conditions of the lower extremity when loading's involved, where I may actually advise that the patient lose a little bit of weight to help them to manage their condition. We know that high BMI is a risk factor for shin splints. So if you are overweight, in some cases, this may be a good strategy to help decrease the load that's going through your tissues. So it's not always about maintaining a balance in terms of nutrition or in terms of calorie intake. Sometimes weight loss may be advised as well. And if you are going to lose weight, then I'd advise keeping protein intake adequate again or high in order to minimize muscle loss and prioritize fat loss. Now, whenever we advise that for a patient, we'd always direct them to a sports nutritionist so they can discuss those nutritional needs with them. Runners, including myself, are particularly guilty of doing too much. Running too fast when they're supposed to be doing slow runs, or low intensity runs, running too far when they're supposed to be doing shorter runs, doing sprints when they're supposed to be walking, or just running on rest days when obviously they're supposed to be resting. I'm guilty. You're probably guilty at doing it at some point. But when you're injured, it's important to consider the amount of load you're putting through your body. So getting your programming in a good place is important. And you won't get away with these sorts of naughty mistakes when you're injured. It will highlight itself if you're doing too much when you're already in pain. So what I'd advise you do is speak with your coach, your team, if you've got one, or your physio, your osteopath, your strength coach, whoever it is that helps you with your running, or if you're super informed yourself, if you're an athlete, and figure out a good loading strategy whilst you are injured. Now, what I would personally recommend for shin splints specifically, or for lots of loading injuries in the leg or in the lower extremity, is that we decrease speed, certainly, decrease distance as well, maybe decrease some of your hills or avoid hills altogether with slightly higher loads going through your tissues on the hills, and maybe spend less time on uneven terrain. That's a good way to kind of manage your load. Now, it will look different for everyone, but those are good sort of factors to consider and look at in your own programming where there is potential for some wiggle room, where you can decrease pain and start to improve your shin splints. Sleep is such an important factor when training, as you know, and when recovering from injury. And it's something that we can often neglect. We've got busy lives, got lots of things to do, work, training, family, etc. So sleep can sometimes be put on the back burner. But what I would recommend is that we try and focus and zoom in on our sleep a little bit and try and make it a priority, certainly if we're recovering from an injury. Now, there's lots of research out there that talks about sleep and its benefits in sporting performance and pain tolerance and injury risk and injury recovery. And around 7 hours sleep seems to be a beneficial place to start. Now, if you're training particularly hard, training for an event, or you're training for long durations, etc., you may need up to 10 hours sleep for optimal recovery. But I would start at 7 hours sleep if you can manage it. I prioritise getting at least 7 hours sleep at night. And the reason why I do that is because I know, with my patients that if I advise them to sleep more, they get better benefit, they recover quicker from injury, they're in less pain. And there's also research that shows that you're at increased risk of injury if you've had less than 7 hours sleep at night. And also that your tissues tolerate pain less when you've had less than 7 hours sleep. So you're much more sensitive to pain following a poor night's sleep. So of course I was always going to get to rehabilitation exercise as an important part of your recovery. When we're helping people recover from issues such as shin splints or helping runners recover, there's a few factors we try to consider. Now, I like to look at the local tissues, so all the tissues around the area that could be causing pain, and like to prescribe exercises that address those, but also like to look at the whole chain up to the hip or into the core, into the lower back, and look at exercises that help you with loading in general through the lower extremity. If you focus on both of those areas, you can really make a big difference to the way the tissues respond to load. And there's some factors you may want to consider, things like balance, strength in those areas, mobility, flexibility, proprioception, and load tolerance. All those things are important. You can perform your own assessment at home, and compare side to side. You can go and see someone who you can get assessed, and they can give you areas to work on. But I like to always think of local and slightly further away as well, and work on both areas and see if that makes a big improvement in the person's symptoms. What I'm going to do now is we're going to cut away to some videos of me demonstrating the various different exercises, some local exercises, some exercises a little bit further up the chain. This won't be an exhaustive list of exercises. There's a lot of exercises you can do, there's lots of progressions you can make, but it may give you some ideas of places to start. And you can always, feel free to ask us questions in the chat function or inbox us specifically and ask any questions that you have regarding your shin splints. Although gait analysis and gait retraining gets a little bit of bad press in relation to footwear prescription, it does have some utility and some benefit when we're trying to help people recover from injury, or it may have. Every little thing could add up to a big change. So some things we may consider when we're thinking about gait and gait retraining or any drills, etc., related to that. Now, elite runners typically run with a cadence of around 180 steps per minute. Recreational runners tend to run with less steps per minute, maybe around 150 to 170. And what you find is when people run faster, they increase their steps per minute and their cadence, and when they run slower, they decrease their steps per minute. But there is some research that suggests that if you run with a higher cadence, so increasing your steps per minute, that may actually decrease the amount of load per step, therefore hopefully reduce the amount of load going through the specific tissues that are causing pain, and maybe reduce pain whilst exercising, specifically with shin splints or with any other kind of lower extremity condition. For anyone that's tried to change their cadence or increase it, they'll know it's quite tricky. So what I'd advise is you can do a few things. What I'd advise is just, if you are going to use this as a strategy potentially, and remember, when you increase your cadence, you will decrease your stride length. So it may help you to prevent overstriding as well, which is also a kind of something that could increase load going through your tissues. But if you're going to play with it, what I advise is to maybe choose a run that you're going on and maybe spend 5 minutes at the start of the run, 5 minutes in the middle of the run, and 5 minutes at the end of the run, increasing your cadence slightly, so your step per minute slightly. It's very, very difficult to maintain it throughout the whole run, but do it in little bursts like that. And if you've got data that you can look at the end, maybe from your heart rate monitor that tells you, your cadence or your steps per minute or your stride length, that's great. Look at that afterwards and say, okay, I've done a good job of increasing it. But also refer back to your own personal data as to how you felt when you were doing that. That's the most important thing. Did it feel any different when you increase your cadence? Did it feel better? Did it feel worse? All this information is really important. So if you find that it's actually, when you're doing it, it is, causing a short-term reduction in pain when you increase your cadence, maybe this is a viable strategy for you. Footwear is another one of those issues that's always a bit contentious with people. But the truth is, there's no one perfect footwear that we can recommend. What we advise is that we go for a comfortable shoe that fits well, that you feel comfortable wearing, essentially. Now, that can be a heeled shoe, that can be a shoe with kind of zero drop, all that type of stuff. It depends what you're adjusted to and what you're used to wearing. I've said it before, don't wear flip-flops, not a good idea. I choose to wear Brooks. I have various pairs of these, which I like wearing. Other running shoes are available. I've worn Nikes in the past, Asics in the past. Currently I'm wearing Brooks, I like them. But there are some things to consider when you've got your trainers. Now, it's a good idea to consider the age of your footwear. So if you've had your trainers for the last 10 years and you're scratching your head wondering why you're getting shin splints now, and you look at your trainers and they're unevenly worn on the side from side to side, maybe that is a problem. Another factor that may be worth considering is to think back to a time when you used to run pain-free, for instance, or with less pain, and think back to the shoe type that you were wearing then. Is it drastically different to the type of shoe you're wearing now? Did you go to a running shop and they told you that your gait was a certain way and your foot was doing something funny and you had to change your shoe? And is that also a factor? If it is, maybe going back to a shoe that was maybe previously working better for you is potentially an option. And one final thing on footwear, I like to have at least a couple of pairs of running trainers that I do my general runs in. The reason why I do that is because when you're running a certain type of shoe, you're going to be loading your foot in a certain type of way the majority of the time, especially if you spend a lot of time on flat surfaces like roads. If you're off-road, you all bets are off. You're loading your foot in all sorts of different funky ways. But if you're running a lot on roads, wearing one certain type of shoe, you're going to be loading your foot in a certain way. Now, when you have a variety in your shoe, your foot's going to be loaded slightly differently in the different type of shoe. And I'm not saying have two shoes that are kind of light years apart in terms of style, but two similar shoes, maybe, but they're slightly different, maybe slightly different in age, and the same shoe, or one that's slightly older, one that's slightly newer, can help you to decrease potentially. I'm not saying it's going to work for everyone, but certainly for me, I like doing it because I believe that it helps me to reduce injury risk by decreasing the amount of load that I'm exposed to in similar ways time and time again. There are a whole host of other modalities that you could also include that you may want to include in your rehab approach. Now, I've covered a lot of the really important ones in the earlier sections, but I'm going to go over a couple more now, just things you may want to consider. The first one's manual therapy. Now, manual therapy is kind of the hands-on stuff that you get when you go and see a physio or a chiropractor or an osteopath, massage therapist, or it's the hands-on stuff that you apply at home to yourself with a gun or a foam roller or your self-massage. Now, manual therapy can help to decrease tissue sensitivity and therefore decrease pain. So if you're looking for a way to make your tissues a little bit less sensitive, and then maybe go out running on tissues that are less sensitive, and then hopefully have some longer term strategies like a sensible rehab approach with exercise and sleep and nutrition and all the other factors that we've spoken about, manual therapy may be a good shout. And final thing is stuff like heat and ice. Now, no one of them will magically change your tissues or create this kind of magic physiological state for recovery, but working clinically with patients day in, day out, on having discussions with them and what they use and what works for them. People will swear by heat or ice in these types of situations. I spoke to someone last week, one of my patients, who was a runner, who swears by having a warm shower before she goes out for a run to help her with her shin splints. So, heat and ice, once again, they're sensory stimuluses that can decrease tissue sensitivity short term and may make it tolerable to go out running, and therefore you can still do what you love with less pain whilst you're focused on your longer term recovery. Well, that brings us to the end of our first masterclass series on shin splints or medial tibial stress syndrome. I want to thank you all for sticking around and watching the video. If you have any questions that you want answered regarding shin splints or any other running related injury, you can pop it in the comments section or send us a direct message on one of our social channels. We are happy to ask all questions. In fact, later on this month, we'll be hosting a Q&A session specifically around running related injuries. Thanks for taking the time to watch. We really appreciate it. We hope that you found something very, very useful from today. And if you did find it useful, let us know if you found it useful. And also, If you feel like anyone that you know would benefit from this information, feel free to share that with them. We'll be happy for them to see it too. I'm Dale Hardiman from Hardiman Performance, and we will catch you again on this channel very, very soon.